Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about how to best protect your team and your patients amid COVID-19. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you.
Hi, Allison. I can't believe this is our 14th episode.
I know.
You know, all of our previous episodes, we've gone through the basics of infection control and then infection control changes during COVID-19 and adapting to airborne infectious diseases. And then what OSHA says for safety, for our guidance on that, and CDC's guidance and all of the PPE. So we've covered a lot of topics in the 14 episodes since closure started. That's really when we started this on March 16th. And now here we are right in the middle of July, and we're looking at changes that are happening in the next 4 weeks, schools reopening, and maybe even some of the financial supplement programs from the government are ending or maybe extended. So there are a lot of changes that have happened, but then there's also a lot of leveling, I'm going to call it, because my perception is ortho offices really have implemented the basic guidance from CDC and OSHA. You know, we've talked about the ADA toolkit and the OSAP DentaQuest best practices as guidance for them, provided lots of documents in all of our episodes. But you know, in the last week, I've spoken with several doctors, and I think there's a new challenge that's coming up now. The team has implemented infection prevention. They've implemented all this guidance, but we need to look at it from the point of view of our patients.
Right.
I had an orthodontist from the Northeast that I talked with last week, and he said in his area, he's getting some pushback from patients as they come into his office.
Interesting.
Yeah, and I asked, I said, what do you mean pushback? And I was thinking of, you know, the Karen video that went viral about the woman who didn't want her temperature taken in the dental office. And he said, yeah, well, this doctor said, no, it's really that the patients are anticipating coming back into the ortho office after closure, that many of the amenities that they had before closure would still be in the ortho office, because ortho offices have always been fun. Right. You know, we put the fun in braces, in change. You know, we don't just put braces on, we change lives. You know, we provide them with this beautiful, and it's always been a milestone for children and adults that have braces. You know, so it's been a fun place. You come in and there's the coffee bar and the magazines and the videos are going, and there's the game room open. And, you know, that's part of the new patient exam. When patients come through on tour, the kids go, oh, Mom, I want to go here. Look at this game room.
Okay.
And now the game room's closed.
Right.
And so that's sort of a disappointment, as you know, patients are coming back in, and parents are coming back in, and so those are not there. And that's what this doctor was saying. He said, I didn't anticipate this.
Right.
So I think that it's important for us to continue to share with our patients why we're taking these infection prevention measures.
Right.
And maybe post it on the Facebook pages, on social media, on Twitter and everything, and use humor with it. Use a little bit of humor. And I was going through some of my pictures for infection control that, you know, I've got all this humor file that I save for my PowerPoints when I'm doing AAO webinars and seminars. And I found this funny infection prevention rocks poster, and it was provided by one of the companies. But I mean, we can put a little bit of humor in all of these. And look at this one. If you're sick, stay home. Well, that puts a smile on our face, right? It gets the point across about infection control. So maybe we can share this on our social media, and even print out these posters and put them on the door of the office, or
Right.
send them in a text message, or put some sort of humor in with the text message. I even
Hmm.
pulled out for our webinar today from 2007. I have this frog with braces on. Let's take photos. I remember Rosemary Bray when she spoke at an AAO meeting several years ago, when The Lion King was first, when the movie was first out and everybody was going to see The Lion King, and she introduced a stuffed Simba with braces on.
Oh.
And I go, oh my gosh, how did she think of that? That is so creative. And here she was, actually giving those away as the treatment coordinator in her office to those new
Wow.
patients that came in. So
Hmm.
those are the fun things that our patients have anticipated. And we've taken away the coffee bar. We've
Right.
taken away the Otis who? What is the name? Otis Spunkmeyer
Yeah,
cookies
I'll
that
probably
we
say
used to,
wrong.
yeah, that we used to, and you walk into the ortho office at 3 o'clock in the afternoon and, oh, it smells so good. But now with an airborne infectious disease, we're not
Right.
serving that anymore.
Right. Okay.
So what can we do to put
Yeah,
those
exactly.
amenities, yeah, to put the amenities back in? And I had an interesting experience this last week. I try to reduce the amount that I go out in
Right.
public, and so that I am being safe. And I'm in Florida.
Hmm.
We have the highest rate of infection right now. But
Yeah.
you have to go do a little bit of shopping, especially for food. And I
Right.
went to my favorite store, Trader Joe's. Now, being in Florida, it's hot and humid. It's the
Right.
middle of the summertime. Trader Joe's is a relatively, as grocery stores go, small, less
Hmm.
square footage store, and they're limiting the number of customers that can come in at one time.
Okay.
Just like the ortho office doesn't have their waiting room full anymore, and that's
Hmm.
why the game room has been closed.
Right.
So at the time of day that I arrived at Trader Joe's, they were having to have a few customers wait outside
Hmm.
in the hot sun and
Hmm.
stand for a few minutes. But as true to Trader Joe's, they made it fun. They had a tent with two of the crew in there. I love that
Yeah.
they have the store manager is not a store manager, it's the captain at Trader
Yes.
Joe's. And they have
Hmm.
the crew, and they've got the bell that they ring for certain occasions. So it's similar to the ortho office in that we did put the
Yeah.
fun in with
Uh-huh.
Trader Joe's. So while I had to wait, they had a shaded area that where they used to put the grocery carts, they had put for customers to stand in the shade. They had a fun tent out there. They had two of the crew members with extra masks, and this giant cooler with ice cold bottles of Trader Joe's water. Oh my gosh, that made standing out in the sun, it was less than 5 minutes that I
Hmm.
stood out there, but
Right.
everybody was masked, and they had extra masks for the people that weren't, but it put the fun into it rather than
Right.
going, oh, I got to stand out
Okay.
here in the sun and wait to get in. Maybe the ortho office, we can't give them coffee, but can you have
Mhm.
ice cold bottles of water to
Right.
give your
Okay.
patients? And if they have to wait in their car a little bit longer, can you send them a text message? Do you need a cold water while you wait? And I've even seen where Hulling's Orthodontics was one of the first offices that I saw. They put their own Hulling's Ortho labels on their bottles of water.
Ah, okay.
So maybe we can do that. And since it's the hot summertime, and when we put in, ortho puts in night-high wires,
Hmm.
then you feel the pressure of it, and cold helps be a comfort for the patient. So maybe we've got some of these frozen icicles. That would be an inexpensive frozen something individually packaged that you could say, would you like an icicle to eat on the way home?
Hmm.
And you give them that individual icicle. We're not going to get into, now I've seen some offices that actually have a frozen cooler, and they have a whole selection of frozen treats
Right.
that the patient can choose from afterwards. But
Mhm.
maybe those little icicles would be something that we could add back in
Right.
as an amenity for patients. And again, put those friendly messages up with a sense of humor about what we are doing for their protection to prevent disease transmission.
Right.
One of my favorite business books, and it reminded me so much of the ortho office,
Hmm.
was Tony Say's book, Delivering Happiness. Now,
Okay.
Tony Say is the one who founded Zappos.
Oh, okay.
Now, you probably like shoes as much as I
Yes.
like. And when I had never bought shoes on Zappo online until I bought them from Zappos the first
Oh,
time.
okay. Hmm.
And he wrote the book. The title is Delivering Happiness. And what Tony Say says is, we're not delivering shoes. We're delivering a box of happiness.
Mm.
We're not delivering braces. We're delivering a happy smile. So I maybe we need to circle around, if you
Right.
will, do a refresh in the
Yeah.
ortho office and put that fun, that whimsical, that humor back into the
Mhm.
office. Yeah.
It's finding that balance between the serious aspect of this pandemic and then also just remembering why a patient may have chosen your practice.
Yes, and communicating that. And there's been so much serious,
Yeah.
on the news. We're bombarded with it every day. What are the new
Mhm.
infection rate numbers? What are
Right.
the new death numbers?
Mhm.
Transmission, and the arguments between politicians about, do you
Mhm.
wear a mask or do you want to? Some states have had that. Some have had less of that confrontation. Even the social unrest that's going on at this time. So pushing that refresh button, put the positive in. I heard
Yeah.
a sign off from that a Zoom meeting that I was on
Mhm.
last week, and what Edwin Zinman, he's an attorney for dental practices, and he signed off with share positive and test negative.
Mm.
I
Yeah.
think we need to share the positive now
Right.
with that. So I would highly recommend that offices, maybe one of the other things they can do is start a contest in their office.
Right. Yeah, I've heard a
And
lot of practices haven't been doing the contests.
they
Yeah.
haven't. We've been so wrapped up in getting the right PPE and learning how to wear an N95 respirator and doing
Right.
that seal test and getting hot behind all that PPE
Yeah.
that maybe contests have gotten put to the side. So
Yeah.
I would love for ortho teams, and maybe they'll share that information with us for our In the
Mhm.
Sterilization Room episode, is to have a share a smile contest with their patients.
Yeah.
And, kids, well, kids and entertainers, actors, musicians,
Mhm.
they're not getting to perform in auditoriums or playhouses or anything anymore. So that
Yeah.
share a smile with your patient, start a daily or a weekly contest that patients can, young patients can draw a picture. They can take a photo of something that made them smile that day.
Mhm.
Maybe they can record a song that they
Right.
wrote
Yeah.
about what made me smile today, what made me happy
Yeah.
today. And you've probably seen the same thing, and I think all of our listeners have on Facebook, that sharing the positive, maybe it's share a flower of the day or
Mm.
share a photo from your photo album. Well, let's share a smile.
Right.
Let's let the ortho be the inspiration, the orthodontic practice be the inspiration for your patients, for the rest of the team, and
Mhm.
for your community, to
Yeah.
share a smile and share the positive.
Yeah.
So that's what I'm going to challenge offices with right now. I'm looking around on my show and tell items that I laid out, and I had a card. And ortho offices used to send out cards to their patient, written cards that
Mhm.
would go by the U.S. Postal Service and wind up in the mailbox, not an email with it.
Right.
And you'd open it up, and it was, congratulations on your great appointment today. I know getting your braces on was a little difficult, and you were a fabulous patient. And for many other, we've sent in those cards. But let's get back to having fun cards that we address and send out by snail mail, and
Yeah.
that patient has something bright, colorful, and happy to open. And maybe it's even taking photos of team members with their mask on, or photos with their pet, and Photoshop a mask onto the pet. How can we put that fun, that humor, share a smile with our
Right.
patients on it?
Yeah.
So I think that's our message today. We've got the guidance.
Mhm.
We're still fine tuning it, because even Dr. Jay Bowman sent me a couple of publications, scientific publications this week that are
Hmm.
looking at how is the virus spread.
Right.
Is it more aerosol or is it airborne? We're getting more research and more information in.
Yeah.
And I do want to share another serious moment before we end our video interview
Right.
today. Dr. Trista Felty, I have gotten to know through the AAO
Mhm.
COVID-19 task force. And
Okay.
Dr. Felty practices in Canada.
Hmm.
And we were discussing in the task force about the difficulty of finding guidance of what to do if you have an exposure,
Hmm.
either a patient tests positive, an employee tests positive or has signs or symptoms, or maybe the boss of the spouse of the orthodontic assistant tests positive. Do you
Right.
need to isolate or quarantine? And that's still a big challenge for the ortho offices.
Yeah.
Yeah. And Dr. Felty shared with the task force and with me what they're doing in Canada. And I think it's a very easy, logical, easy to implement. They talk about degrees of separation.
Okay.
You're familiar, you've heard about degrees of
Yeah.
separation, right?
Yeah.
That,
Yeah.
yeah, what would that mean to you if you heard that?
Well, like one separation might be the person you live with, and then the next degree would be who do they interact with, and then the next degree, so on.
You're
So,
exactly right. You're exactly
right.
right. So Dr. Felty, when she said in it, she said an exposure is 1 degree. So for example, only the person directly exposed needs to isolate. So this means if you have an assistant whose husband's coworker tests positive, the assistant does not need to isolate unless her husband tests positive. So if you have
Okay.
a family member that you live with, your
Hmm.
spouse or your child that you're in the house with, and they test positive, show signs or symptoms, have active infection, yes, then you're going to need to isolate,
Okay.
for that 14 days, whatever the recommendation is, from your health department. And we still
Mhm.
need to go by the local guidance from our health department.
Right.
And then it says, when say the husband is exposed or your child is exposed. And I like Dr. Felty's example here. She said, when she and her husband, um, excuse me, her husband went to a dental conference
Okay.
and there was an exposure at the dental conference. So obviously someone tested positive at the dental conference. And she said, my husband was an attendee and he had to self-isolate, but I was allowed to continue to work because I didn't attend the conference. So
Okay.
you have to look, it's that first degree of exposure, then
Hmm.
yes, it's wise to self-isolate. But if it's
Right.
a second or third degree, then you continue to watch for signs or symptoms, take your
Hmm.
temperature every day, just like we're
Right.
doing.
Right.
And so I think we need to take that perspective on of how many degrees of separation is it before
True.
you determine whether you need to isolate or quarantine, either with a patient exposure. Was it the patient that came in that
Hmm.
48 hours later developed signs or symptoms? Then that might be a first degree of exposure for the assistant who cared for that patient.
Right. Yeah, that makes sense.
Okay. But
Yeah.
for the rest of the team,
Hmm.
if they didn't provide direct care for that patient,
Hmm.
then there wouldn't be a need to isolate or quarantine. So
Right.
you have to look at the degrees of separation to determine what's your risk and do you need to isolate or quarantine.
Yeah.
So lots everything is continuing to change. New
Hmm.
information's coming out, but I would say to the ortho teams, stay the course, stay safe, and share a smile. Let your patients, your team members, share a smile at your morning huddle if you
Right.
have, if you're having morning huddle, so that
Mhm.
you lift up with the positive. Remember, we're delivering happiness.
Well, I think this is great information, and I really do hope it kind of puts a little bit of the positive into the day, given
Yes.
everything that's going on. So definitely. Thank you, Jackie. Well, we will be back for the next episode of In the Sterilization Room. In the meantime, be sure to keep up with the latest orthodontic industry news or check out past episodes of In the Sterilization Room with Jackie at orthodonticproducts.com. Or sorry, orthodonticproductsonline.com. Until next time, take care and stay safe.
And share a smile.
There you go.